Okay, so we have talked about original Medicare, Part A and Part B. We have talked about Medicare supplements, also known as Medigap. The other choice that you have is a Medicare Advantage Plan, also known as a Part C. When you hear somebody talking about Part C or a Medicare Advantage, it is the same thing. I am going to be very open with you guys and let you know there is a lot of controversy and a lot of debate on whether a Medicare Advantage plan is the right plan for people. I am going to say this. A Medicare supplement can be very expensive, right? And I'm not a fool, and I understand that. And I understand that not everybody can afford it. In a perfect world, would everybody that follows me and everybody that is my client have a Medicare supplement? Absolutely. But let's be real, right? It doesn't happen that way. And a Medicare Advantage plan, also known as a Part C, can be a very, very good option for some people, okay? Now, I want to be clear. When you have a Medicare Advantage plan, also known as a Part C, you are giving up your original Medicare. You're still paying for it. They make you pay for it. But you're going to go ahead and put it on the table over there and forget about it. And now you're going to go into this plan with this insurance company, whether it's ABC Medicare, XYZ Medicare, LMNOP Medicare, and you're going to go by the rules and the networks and everything that they set into that plan. That is what you're going to follow. And they are going to take care of your Medicare for you. All right. You have a choice, an HMO or a PPO, okay? Both plans have set copays for the hospital, for the doctors, for the specialists, urgent care. Both plans have a max out of pocket, or also known as a MOOP, M-O-O-P, okay? There is no deductible in Medicare Advantage Plan. There's MOOP, max out of pocket. That means that is the most that you'll pay for your health insurance coverage or your health care that year. January 2026, it resets, okay? So just say I'm in the hospital and I have been in the hospital for a while and I have paid all of my copays between the doctors and the hospitals and the urgent cares. It does not include your prescription drug care copays. But I've paid all of those and I've reached my max out of pocket or my MOOP. And sometimes it's $3,400, sometimes it's $1,500, sometimes it's $10,000. It just depends on the policy. Once I've reached that number, I will not pay another copay for the rest of the year. January 1st, it resets and I'll start paying again, okay? With a HMO, you pick a doctor that you want to see who is your primary care physician or PCP, okay? And when they say to you, hey, Miss Sue, you need to go see an orthopedic, and they give you a referral, okay? And then you call the orthopedic and say, hey, you know what? Dr. Patel gave me this referral to come see you. I need to set up, you're in network, blah, blah, blah. So you have to stick with referrals. You have to stick with networks. And the networks can be bigger or smaller, but the area that your plan is good in is usually a condensed area. Maybe 3, 4, 5 different little areas, counties or cities, depending on how it's set up, is where your area is going to be, where you stay in network, okay? When you have an HMO, you do not have coverage outside of your network, except for the emergency room, okay? You will have coverage in the emergency room. So if you're on vacation and something happens, and you need to go to the emergency room, you have coverage, okay? Now, you are going to have lower copays with an HMO because they are having more control over your health care and who you see and things like that. With a PPO, you have a little bit more wiggle room, okay? You can go out of network. You're going to have 2 of everything, 2 sets of copays, 2 sets of max out of pockets, and networks. What I want to say about a PPO, while they are great, and they give you more freedom to see somebody outside of network, that does not mean that the doctor has to take that plan. I would suggest Always calling the doctor and saying, hey, I have this PPO, but I would really like to see you. This is what I have. Will you accept it? They do not have to take it. So it's good practice to know that before you get there. Okay. Because I can promise you, I'll get tons of people calling me and say, well, this, even though I tell them that, they say that. Okay. So now that we've talked about that, why do people like Medicare Advantage plans, or also known as Part C? They are usually have extra benefits. So they're all going to be set up the same. You have your Part A, your Part B, your Part D, because most of them have your prescription drug plan already built into it. And then they'll have ancillary products like vision, dental, hearing. Sometimes they'll have the gym. Sometimes they'll have over the counter. Over the counter just depends on how they have it set up and how much you get, but you can go into a drugstore or order from a catalog and get some, medications or deodorant and things like that. So people like Medicare Advantage plans because they have everything in one package. It's like the value meal of Medicare, right? Now, the reason why people say that they are not good is because they are more restrictive than a Medicare supplement, right? You have referrals, you have, and you don't need a referral with a PPO, but you have referrals with the HMO, you have networks, you have rules, and they can deny, services on both an HMO and a PPO, where on a Medicare supplement, they don't do that because, there's no questions asked. But when it comes down to it, most of those PPOs and HMOs are $0 premium. So that is very enticing to people. If you can't afford, or you choose not to want to afford or not want to pay for a Medicare supplement, and you want to keep your health care low, then a Medicare Advantage plan can be really good if done the right way. Your agent that you're sitting down with needs to know about all of your doctors, every single doctor you see, from your PCP to your specialist, to your dentist, to your, everybody that you see. They need to know all of your medication, not some of it, but all of it, because we put everything into a system, and that is how we know what is going to be the right plans for you in that area that you live in, okay? They should be asking you about your lifestyle. They should be asking you about, your wants and your needs. Is over the counter really important to you? If it is, then that's something that we need to look at. Is transportation really important? There's some of them out there that have transportation. So there's a lot of different things that when you're choosing a Medicare Advantage plan that you need to think about. Let me just say this. If you're talking to somebody and they're helping you with your Medicare and you are sure that you want a Medicare supplement and they are pushing you towards a Medicare Advantage plan, get up and leave. And if you are talking to somebody and you are absolutely sure you want a Medicare Advantage plan and they are pushing you towards a supplement and you know damn well you can't afford it or you don't want to pay the extra money, get up and leave. Okay? Because there's plenty of us out there that will do the right thing and help you do it for you. I also want to say this. Do not take advice about Medicare Advantage plans from friends, strangers, or family. And Medicare is not a one-size-fits-all for everybody, okay? Your needs and your husband needs and your spouse's needs are all different, and your needs are different than your sisters and your brothers and everybody else's. So let me just say this. I've had clients that I've put on Medicare Advantage plan, one spouse, and the next one needs a Medicare supplement. So it just depends on what everybody's health care needs are. If you guys have any questions about Medicare Advantage plans, put them in the comments and we'll start talking about it. Have a great day.